A new report from the UN says radiation from the Fukushima nuclear disaster has not harmed the health of local residents. It comes as Japan marks 10 years since the earthquake, tsunami and nuclear disaster tomorrow. The UN report confirmed a previous study conducted in 2013. It says there have been no adverse health effects among Fukushima residents that's directly linked to radiation exposure. It also dismisses an increase in thyroid cancer among local children. There were concerns that was caused by radiation because there was also a rise in such cases after Chernobyl. But the UN says the rise is more likely because of better diagnostic equipment, not the effects of radiation. But not all agree. Greenpeace Japan has warned large areas near the damaged nuclear plants have still not been properly decontaminated. Michio Yoshida joins us live from Tokyo for more on this. Michio, contradicting reports about the health impacts of the nuclear disaster, what have Japanese authorities said?
Well, medical experts here in Japan have been stressing for a few years now that the highly sensitive ultrasound equipment as the reason for the detection of thyroid abnormalities among children. Now, Fukushima Prefecture has tested children in two phases, 370,000 in the first and 382,000 in the second. This is according to their website. Then every 2 years until the child turns 20, then every 5 years. Now, a doctor who screened 1,000 Fukushima children confirmed that 202 had cancer, which is a higher ratio than the national average. And in a separate data from the National Cancer Institute, Fukushima has the highest ratio of stomach cancer patients after 2012. But there's no clear correlation with the nuclear disaster. Overall, half of Japanese people are believed to develop cancer at some point in life.
Michio, what's the condition of the damaged nuclear plants like now? Is it safe to be around that area?
Well, in February, if you recall, there was a magnitude 7.1 earthquake, which struck the Fukushima area. And we heard that water level in the reactors of the Fukushima Daiichi nuclear plant fell. And there were containers storing decontaminated water being affected. And Tokyo Electric Power Company failed to report any of the damage immediately. Now, Fukushima Governor Masao Uchibori said in a news conference, his concern is the state of the molten fuel debris, as the situation is unknown. Now, the reactors have to be cooled, water has to be used, and contaminated water is building up in the facility. And we've been hearing that by autumn 2022, the facility will be all full. And what to do with this water? Well, the government has been keen on releasing the water into the sea, but this is not a popular decision for the Japanese public. And the Suga cabinet lately has been announcing new plans for reconstruction, revitalization of the Tohoku, Northeast Japan area, but it has put off the decision regarding this contaminated water. But the clock is ticking. Now, as to residents of Fukushima, 12% of Fukushima area was designated the evacuation zone after the 2011 triple disaster. Today is 2.4%. Now, decontamination has to be conducted in the 2.4% area. As to the return of residents within the 20-kilometer radius from the nuclear plant, we hear that 56% are back in Minami Soma. However, to Okuma town, where the nuclear plant is located, only 2.8% have returned. And also, Okuma is serving as a space to store the contaminated dirt as an interim storage space.
Michio Yoshida, thank you.